Welcome to another video. Today we're gonna talk a little bit about this pathology that affects a lot of horses here in Florida especially. And there are two different diseases that we're gonna talk about today. One, the famous summer sore or habronemiasis. The second one, Pythiosis, which is not as common as Habronema, but it happens. And there are significant differences that we have to look up for that. So this horse came in because he has some non-healing wounds. That could be the main form of presentation of these diseases, because that's how it happens. They start to be like a small one, they start to get bigger, and the owner tried to treat it at home with no success. And then they bring us to us. We can diagnose it as a summer sore or some other stuff like Pythiosis or some other skin diseases. Pythiosis itself, it can be treated, but sometimes, depending on the location, it can be fatal for the horse. These kind of lesions, they are often found in distal limbs, more really on the face, but it can happen. But if it's next to a synovial structure that could get affected with time, that could be a life-threatening situation. So even seems like a simple wound, you have to take care, and the sooner the better, in order to have a better prognosis for the horse. And now I'm gonna go ahead and remove all these lesions, taking a good sample for the lab and also treating at the same time by a surgical excision, which this is the main treatment for Pythiosis. Also we can help him with some medications as well, but if the main thing is to try to remove as much as we can from the affected area. Okay, so here we removed the tissue. This is the whole lesion. I cut it in half, and you can see how the necrotic tissue is going deeper and deeper. I think we removed most of it, if not the 100%. We're gonna take a little piece of this, send it to the lab, and they're gonna tell us if it's actually Pythiosis or it's just Habronema. Based on what I'm seeing, it has Habronema because there are some granules in here that I can see, but the question is, does it has also Pythium or not? The only way to know is waiting for the lab results. If it comes back as Pythiosis, the good thing is that we are already treating it, because the first thing that you should do, if it's possible, is surgical removal of the affected area. In this case, it was easy enough because it's not next to any important structure, such as the joint or a big vessel, so we're already treating it. But once the results come back, we can add some medications or not. We're putting an ointment to promote healing of that wound, and we're gonna put a bandage to protect it from flies and dirt. We're gonna change it every day until it heals.